Well, back pain is something many of us associate with getting older, but for a lot of people it starts much earlier, sometimes in their 30s and 40s. So what's behind it and what can we do to prevent it?
To help us understand why back pain is so common and how to keep our spine strong, Meg Judy sits down with a pain medicine physician at MU Healthcare in this week's Focus on Your Health.
Focus on Your Health is sponsored by MU Healthcare.
Welcome. I'm joined now by MU Healthcare pain medicine physician, Dr. Ebby Varghese. Thank you so much for joining us.
Thank you for having me.
I feel like this is for me, back pain. Like, can I talk to you about my SI joint?
Please do.
Yeah, okay. Why is back pain so common? Everybody has it.
Well, it's common because we use our spine for all the activities we do. And yes, it is a natural part of aging. If we take an x-ray of somebody who's otherwise healthy, we're going to see degenerative changes. But there are things that we do that actually aggravate our back.
You probably need the right habits then to keep that from happening.
There are certain things that we would like or expect patients or people to do to keep their back healthy. Mm-hmm. Maintain a certain weight, not smoke. We know we have good literature that demonstrates that smoking advances spine degeneration. Also, if we are overweight, we can load the small joints for our spine, which can also lead to joint arthritis and then eventually spinal stenosis.
Would you say it's difficult to treat?
It's difficult to treat because there are a lot of different things that can cause back pain.
Yeah, I would imagine that's probably true. And then people assume, okay, I've got back pain, I'm getting treatment. Oh gosh, the next step's probably surgery. Is that true?
Well, no. Actually, about 95% of patients don't need surgery. We did a very good study at Missouri Orthopedic Institute that demonstrates only 3 to 5% actually go on to have surgery after they've been referred to a surgeon. Most of the time, they only need conservative care or some advanced treatment options that don't include surgery.
Well, that's a really encouraging percentage. And what are the non-surgical options at MU Healthcare?
There's a variety of different things. We would start with probably a home exercise program that would transition to probably structured physical therapy. We can offer non-opiate pain medications. We have other prescription pain medications that work on different types of pain. And then if there are injections we can offer, we try to do that first before we even consider a surgical route.
So talk to me about the offerings at MU Healthcare Spine Center. I need a referral, correct?
Yeah, we need a referral because we need to see where the patient's coming from and what their medical history is, and that's super important. But we have 2 locations for the MU Healthcare Spine Center, Missouri Orthopedic Institute, as well as Capital Region Medical Center. At both of those locations, you'll find our non-operative spine providers, and then we also have fantastic surgeons, neurosurgery and orthopedic spine surgery. And there you can expect a very comprehensive history, a very focused physical examination, and then hopefully from that we can develop a treatment plan that the patient will be comfortable with, and that we can hopefully also identify the pain generator and then treat them and help them get back to their life.
Which is amazing because back pain, it can really just shut you down. So.
It can very much make you feel incapacitated.
Thank you very much for joining us and sharing your expertise.
Thank you again for having me. You're welcome.
We appreciate it. And to learn more about MU Healthcare's back pain treatments, visit muhealth.org/back relief. For Focus on Your Health, I'm Meg Judy.
Focus on Your Health has been sponsored by MU Healthcare.